Elizabeth Wise, the president of Lehigh Valley Hospital Pocono. Your health deserves a partner, and that's where we come in. Each month, experts from Lehigh Valley Health Network will bring you topics to help keep you and your loved ones healthy and safe. This month's topics include healthy eating during the holidays, back and neck injuries associated with prolonged sitting and how to prevent that, and concussions associated with sports injuries. I hope that you enjoy the show. Joining me now is Rihanna Sensi, who is a dietitian specializing in medical nutrition therapy. We're talking about healthy eating habits as we head into the holiday season. So my sister's a dietitian, and so I have a lot of respect for dietitians and the value that you bring to the role in the hospital. But tell me a little bit more about what you do at Lehigh Valley Health Network and Lehigh Valley Hospital Pocono.
Okay, well, I've been with Lehigh Valley Pocono for about 2 years now. We do cover the entire inpatient hospital, so we do see patients while they are admitted to the hospital, but we also do outpatient appointments. And we also teach lots of classes for different things. We run the diabetes program and the bariatric program as well.
Oh, thank you. That's very helpful to know. So we're heading into some of my favorite holidays. That includes Thanksgiving, Christmas, New Year. And I have to be honest with you, I do overindulge a little bit. I do enjoy turkey and ham and other things that probably have a lot of salt in them. But what are some ways to eat healthy but still enjoy yourself during the holidays?
One thing I like to recommend is not over-restricting yourself. So it's okay to indulge in some things, but moderation is always key. Also practicing mindfulness. So thinking through when you're going for something. I'm thinking, especially if there's cookies in the break room, right? We might want to think through that before we just grab one every time we walk by, right?
Sure.
So trying to find a spot in your day to make room for that. So maybe I'll have a cookie, but I know that will be my afternoon snack, right? So we do still want to enjoy ourselves, some of those holiday treats, but find a place for them in our day. Along with mindfulness is thinking through, am I hungry? Am I thirsty? If I'm grabbing for something, did I drink any water today? Feeling if I'm full, if I just ate lunch, do I really need a snack right now? So that's one major thing to practice, mindfulness instead of being mindless and just grabbing food.
Yeah, so sometimes people automatically go for something to eat versus there's a need for it. They're hungry or thirsty, like you said.
Exactly. And sometimes people will set unrealistic goals for themselves. So let's say you're going to a holiday gathering and you're like, well, I'm watching what I'm eating. I'm just not gonna eat any appetizers. That might not be realistic, right? So let's set a realistic goal. I'm gonna make myself a small plate. I'm going to enjoy that small plate. I'm going to have conversation with the people here and not just focus on food. And that might be a more realistic way to enjoy that gathering.
This will be a little bit of a different holiday season for us, right? Because of the pandemic. And so we definitely want to do things in a safe way, especially if we're gathering with friends around the holiday or family. So are there any foods that you think should be avoided? I mentioned a couple of some of my favorite foods.
I don't like to recommend avoiding anything. I think if we restrict ourselves too much and we avoid one thing, let's say I'm giving up chocolate, I'm not having any chocolate this holiday season, but then the only thing you're going to be thinking about is chocolate, then we might end up binging on it. So I think to find a way to have it in moderation, give yourself a little bit, enjoy it, so not being too restrictive on ourselves. And I think one thing we can kind of leave out a little bit though are the sweetened beverages. They don't really have a place in our day. We'd probably rather eat our calories than drink them all and set our entire day over on calories without realizing it.
What do you define as a sweetened beverage?
So sodas, if you're having more than 4 ounces of juice a day, that may be too much. Drinking multiple coffees with a lot of sugars and creamers, just high calorie beverages. If you're having sweetened teas, you can try an unsweet tea and add some lemon to it, or try a seltzer.
So there's so many food options at holiday gatherings. You mentioned appetizers, which are some of my favorite. How can I possibly decide about, with all of the options that are spread on the table?
Whew, that's a tough one. I would say the one thing I like to focus on when you get to a holiday gathering are the food groups. I know that sounds so simple, but just trying to picture fruits or veggies being on my plate, maybe among the appetizers, not going for all of the carb options, right?
Sure.
Let's take a few of the carb-heavy options, just a little bit. But if there's a veggie tray, a fruit tray, try to load up on some of those low-calorie items. Maybe like a spinach dip, okay? Sometimes they can be lightened up and use a Greek yogurt, so we can count that as a little bit of a dairy option.
Sure.
And then there's usually some bread there, maybe some veggies to dip in it. Take some of the bread, allow yourself a little bit, but grab some extra baby carrots, some extra celery or cucumbers to go with it, and load up on those veggies. The other time I try to pay attention is, let's say it's dinner time. Everything's out kind of like a buffet.
Yes.
I like to use the drive-by method, okay?
Okay.
So what that
Tell me a little bit more.
What that means is you might want to take a full loop, look at everything that's going to be offered. A lot of times at a buffet, we start at the beginning. We don't know what's next, so we take everything. Right? And then that looks good too. That looks good too. So I like to take a loop, look at all the side options, and in my mind prioritize, do I need a dinner roll right now?
Sure.
No. I'd rather use my carbs on some sweet potatoes and mac and cheese and give myself just a little bit of both instead of filling my entire plate with carbohydrates. And then add some veggies, find a nice green bean casserole or carrots for the side. And then a good protein, so Thanksgiving you might choose turkey or give yourself a little bit of ham at Christmas time or other holidays as well.
I like that analysis of the drive-by and looking at the entire table, because then it helps you decide what options you want to take that'll fill your plate. So how can I make some holiday recipes healthier? You mentioned about the Greek yogurt. I think that's a terrific idea. But do you have some other ideas that we can eat healthy during the holidays?
Little changes can go a long way. I know sometimes a little change sounds silly, but by the time at the end of the day, you saved a little bit of calories here and there, a little bit of salt here and there, and at the end of the day, it's not so detrimental on your health. Let's say a green bean casserole, okay? I know it calls for usually like a cream of mushroom soup, okay? We can always choose that heart-healthy one. It will make a little bit of a difference in how much fat and how much sodium is in it. For the green beans, if you're using canned green beans, choose a no salt added.
Oh.
So even just those two tiny changes will go a long way if you make those little changes in every single dish. Something like appetizers, I like using a light cream cheese or a fat cream cheese, fat-free, sorry.
Sure.
Cream cheese, for a dip that you might make a non-fat Greek yogurt in a spinach dip, and just trying to go light on butter or anything like that on veggies to keep them nice and low calorie.
Okay, great. So I'm going to a holiday party in the evening time. Is there anything in the morning that I should think about eating before I go to the party?
Number one thing you don't want to do is starve yourself going into the event.
Okay.
I hear that all the time. I am just not going to eat breakfast or lunch because I know how much I'm going to eat later in the day. So we don't want to starve ourselves in anticipation of overeating later.
Okay.
All right, so let's start the day out with a breakfast. Fuel yourself with something nutritious and balanced. So maybe you're going to make oatmeal with some cinnamon and fruit in there, or make yourself some scrambled eggs with some veggies and some whole wheat toast on the side. So start your day out as you normally would, or pick something nutritious before you go, because if you show up starving, you're just going to be craving everything the second you see it, and then it's much harder to stop.
So this has been wonderful. Thank you very much for sharing this information with us, and really appreciate all that you do for our community.
Thank you.
We've seen the concern in your eyes. You're scared, nervous, want to know if it's safe. The answer is yes. At LVHN, you'll see the extraordinary steps we take to get you the care you need safely. At all our facilities, you'll see temperature checks for everyone, that we sanitize every surface, and yes, you'll see that masks are required. What we look forward to seeing is relief in your eyes. Lehigh Valley Health Network. Your health deserves a partner.
Before I became president and CEO of Lehigh Valley Health Network, I was a doctor in the ER. I've pretty much seen it all, so I understand why you may be scared to go to the hospital or see your doctor because of COVID-19. I want to assure you that at LVHN, you will safely get the care you need. We are taking every possible step to keep our ERs, hospitals, and doctors' offices clean and safe. So please, don't neglect your health. Take charge of it and know that at LVHN, you have a partner you deserve.
now is a physical therapist with LVHN Rehabilitation Services, Joshua Brennan, who is with us to discuss ergonomics and some tips to help us all work from home and stay a bit more pain-free. So welcome.
Hello.
So doctors have National Doctors Day, nurses have a week, but this is National Physical Therapy Month. So tell me a little bit more about what a physical therapist does and specifically your role here at LVHN.
Here at LVHN, I'm a physical therapist. We evaluate and treat patients with a number of different orthopedic, neurological, and vestibular issues. We create a plan of care with the appropriate modalities and exercise program to get them to overcome their impairments and disabilities.
So I use the word ergonomics. I'm not sure that everybody knows what that means. So tell me a little bit more about what ergonomics is.
Ergonomics is just a fancy way of saying easier work setup and use of how you are using your equipment that you use, whether it be a computer or if you work in like a factory or something like that.
Okay, because we're all spending a little bit more time at home now, right?
Correct.
So you'll give us some tips we'll talk about related to that. So how common do you see patients come in with neck and back pain from computer use, and really what causes that?
Neck and back pain is a fairly common diagnosis that we see. Studies show that there's a 15 to 35% chance of getting neck and back pain over a 6-month period of time with prolonged computer use. There's also retrospective studies out there that look back at the increase in neck and back pain in young adults over the past 10 years, and those statistics rose from 17 to 28%.
Wow.
And the study suggested that's because an overall increase in sedentary lifestyle and increased use of computers and electronics. Pain related to this is usually because we're in a poor posture for a prolonged period of time, and that makes more stress on those tissues that aren't used to where they're supposed to be.
So what are some tips that patients can use to improve their workstation or their posture or their sitting? You mentioned some of those things that cause the neck and back pain.
First, you want to look at your computer setup. You could start with your chair. So you want to make sure that your chair is at a good height. You want to make sure your feet are flat on the floor, and you want to make sure that your knees and your hips have about 120 to 90 degrees of flexion in them. So your thighs would be parallel to the floor and your lower leg would be perpendicular to the floor. You want to make sure you have a good back support in your chair. That helps with your natural curve and lordosis of your spine, which helps you good posture up the rest of the chain. You want to make sure your seat has a good width and depth for you. You want to look for about 2 inches between where the seat is and the back of your legs. Then you want to work your way up. You want to make sure your arms are at a good level, and you want to make sure that your keyboard's maybe about 1 inch above that. Moving on up to the monitor, you want to make sure that's at eye level, and then you want to make sure that it's about 20 to 30 inches away from you, and you can tilt it about 10 to 20 degrees upward so that you're not straining to look. All that being said, if your computer's set up right, your posture will kind of follow, but you want to make sure that you're sitting up tall, your shoulders and head are up and forward to where you're looking at, and you want to make sure that you're not twisting or turning, or everything that you need is close by you.
Okay, thank you. That was really helpful, starting at the bottom, working your way up to where the monitor is in the computer screen. So I know that sometimes people have different workstations, computer workstations, and some I've seen lately where you could stand while you're typing on the computer. So does that help you? Does that make a difference?
Standing desks are a newer trend going on. Statistics haven't showed really a significant difference in whether a sitting desk or standing desk is overall better for you long term. They're showing that they do have a different amount of health benefits as well as productivity benefits. Just like your sitting desk, you want to make sure you're standing in a good posture.
Okay.
Same setup where everything's kind of about right at the same levels, just that you're standing, feet even width apart, and then upright. Good thing about if you could have a desk that converts from sitting to standing, it leaves you the room to alternate your postures and positions throughout the day rather than being stuck in one position for a prolonged period of time.
Do you recommend that people take breaks at the computer and walk away, or maybe march in place or take a brisk walk?
Yeah, it's recommended that every 30 to 60 minutes you take a break from the computer and from what you're doing. You want to move around, you want to do some easy stretches. You kind of want to get your posture in the opposite of what you're doing, so you're kind of in that forward flex posture. So most of the exercises and easy stretches that you could do are to reverse that, So easy back bends, squeezing your shoulders back, rolling your shoulders back, just to kind of reverse the tension that's on those tissues.
So you mentioned some simple stretches that you can perform. Can you talk a little bit more about that?
So kind of just went over them, everything we're trying to do, and after you're in that prolonged position, try to get you out of it. So if you can go backwards and then hold for about 10 seconds, same thing with your shoulders, squeeze them backwards, roll your shoulders backwards. It kind of resets those tissues and lets you be able to kind of reset everything and make you not in that pain or prolonged position for a long time.
So we're in one of our rehab centers here in Tobyhanna. So tell us a little bit about some of the equipment or our aquatherapy that we have available here.
So here we treat a wide variety of diagnoses, like I was saying before. We have a different amount of equipment here, whether it be to strengthen things up. We also have the pool. If you can't tolerate a land-based therapy, it's usually easier on your joints because you're more buoyant in the water. So there's different things that we could try based on what's going on. We try to focus in on your impairments, see what's causing you to have pain, weakness, and then we work on coming up with the best plan and using the appropriate equipment that we have here.
So early on you mentioned vestibular. Can you talk a little bit about that and what that means?
Vestibular therapy is usually people refer to it as balance or vertigo. A lot of times they'll come in with different diagnoses, whether it be a more systemic problem or a more peripheral problem. We can treat it here. A lot of times people don't really think of physical therapy helping dizziness or balance, but there's different treatments that we can do here to kind of decrease some of those symptoms, especially if you're getting it coming into different positions, where if you're sitting and then lying down, that's a treatment that we use here that normally helps with that dizziness.
Okay, thank you. So my sister's been working from home a lot. She has back pain, so I'm definitely going to ask her to watch this segment. And I really appreciate your time and thank you for sharing these wonderful tips with us.
This is a marathon, not a sprint. But we need to go back to work. Our kids need childcare. We need groceries. And sometimes we need a hug. But we also need to be smart. When you have to be around others, you need to wear a mask. It's clear that people without symptoms can be a carrier and spread the virus. So cover your nose and mouth, and let's work together to reach the finish line safely. Our community's health depends on it. Lehigh Valley Health Network. Your health deserves a partner.
Before I became president and CEO of Lehigh Valley Health Network, I was a doctor in the ER. I've pretty much seen it all, so I understand why you may be scared to go to the hospital or see your doctor because of COVID-19. I want to assure you that at LVHN you will safely get the care you need. We are taking every possible step to keep our ERs, hospitals, and doctors' offices clean and safe. So please, don't neglect your health. Take charge of it and know that at LVHN you have a partner you deserve.
Joining us is Danielle Schollenberger, a nurse practitioner and lead for Lehigh Valley Health Network's concussion and head trauma program. We're talking about trauma and concussions from sports injuries. So welcome, happy to have you here with us.
Thank you.
Share a little bit more information. Tell me about your role here.
So my role at Lehigh Valley Health Network is as a concussion specialist, and what that means is that you are a licensed healthcare provider who is certified in diagnosing, treating, and managing the care of concussions.
That's wonderful.
Yes, I've been with the network for 40 years.
Wow.
I have been in trauma the entire time. The last 22 years, I've been a provider specifically caring for concussions and head trauma patients.
Wow, what a wonderful career you've had.
Thank you.
So, can you tell the viewers what is a concussion?
I can. So there are two definitions that are used most readily. One is a medical definition,
Okay.
and that is that concussion is a pathophysiologic process affecting the brain induced by traumatic biomechanical forces.
Boy, that's a mouthful.
The other definition is, you'll see more in media sources, and that is that a concussion is a brain injury that alters the way the brain functions. The point to be made about that is that concussions are treatable. So the definitions sound quite wordy and involved, but really concussions are treatable.
Okay, because that's good to know, because that can be scary, right?
Correct.
If your loved one has a concussion, particularly as it relates to a sports injury.
That's right.
So how many concussions occur a year from sports injuries? What are you seeing?
So the data that's out there I still find is startling. It is 4 million sport-related concussions in the United States every year. And they believe, the experts believe, that that is an undershooting of the numbers because so many concussions go unreported.
Wow, that's a lot.
That is a lot.
So you mentioned that concussions are treatable.
Yes.
How do you normally treat them? What's the plan of care for the patient if they come in to see you?
So I'll explain what happens. So injured athletes are referred to our program by family doctors, pediatricians, emergency centers, emergency departments, even healthcare centers at colleges, school nurses, athletic trainers, former patients. So the injured athlete comes in, and the first thing we do is a very extensive review of symptoms. Okay. There are actually 23 symptoms that we review with each concussed patient. And then we do a very detailed and focused examination, which includes a neurologic examination, a physical examination, and a very detailed and specific concussion assessment. After that, we have the clinical findings, we have the data, and so then we develop a plan of care based on the individualized clinical findings for that patient. That plan of care may include prescribing specialized concussion therapies. It will include perhaps developing academic accommodations if they're school age or college age, and also modifying their activities of daily living.
Okay. You mentioned 23 symptoms.
Yes.
What do you normally see? What are the most common symptoms?
So everyone, of course, thinks of headaches, and statistically, it's probably 90% of patients with concussion will have headaches. But what research has shown us over the past few years is that what's more important is dizziness or any visual changes, and then along with that, imbalance. So if a patient has dizziness after a blow to the head, or they have blurred vision, or they can't focus their eyes the same, their eyes feel sore or uncomfortable, that's actually more telling for us.
I'm fascinated by this subject. How long do you normally have a concussion for? Like, is it a couple days? Could it go on longer than that?
Yes, it can. So what's really important to know is that concussions, if you get a blow to the head and you're not sure if you have a concussion, concussions will still be there the next day and the next day and the next day. So if you are treated within the 2 weeks, you have a very good chance of having a quicker recovery. But actually, statistics show that even 10% of people untreated will go on with symptoms indefinitely. And actually, a recent pediatric article that came out in JAMA said that 30% of adolescents and young children still have symptoms 1 month later. So this is the untreated patient, the patient we're trying to get to come in for the assessment and treatment.
So are there resources available in the network at LVHN that if somebody has a concussion or thinks they have a concussion, that they can get the help that they need?
Yes. So my program, I'm the program director and the practice leader. My program has all concussion specialists. We have neuro-optometrists, and we have very specialized therapists, so we have a multidisciplinary team. So where we are right now assessing patients, one location is at one city center on Hamilton Street in Allentown. Another location is on Shanersville Road at LVH Muhlenberg. And a third location is at 447 Office Plaza, Building 200 in East Stroudsburg.
So you're here in this community, in this county, and able to treat patients.
Yes, we are.
So you mentioned about the referral sources. They can come from a wide variety. Can a person self-refer? Or if I'm a mother, can I refer my child if I think that he or she has had a concussion?
Absolutely.
Okay.
Yes, absolutely.
And so there's resources available. And I like the idea of the multidisciplinary team that works together to help put together a plan of care.
Right.
So we were just talking to one of our physical therapists. And is that an option for people, some type of cognitive therapy that potentially you could prescribe for them?
There are what are called clinical trajectories of treatment, and the first is a physical therapy type of treatment, but it's vestibular therapy. So it's about balance and about eye movements. There's also cognitive therapy, which is memory and thinking. And then we have what's called vision therapy, which is for patients that have prolonged, we call them ocular motor or eye movement symptoms that are really attributing to their headaches, their dizziness, their imbalance, and their difficulty with memory, focus, and concentration.
So what is the age range of patients that you normally see? Is it mostly pediatrics and adolescents, or can adults get a concussion?
So I just want to mention that at the Lehigh Valley Health Network Concussion and Head Trauma Program, we see all causes of concussion. So we see motor vehicle collision patients, falls, workplace injuries, injuries that occur in the home, and of course the sports injuries. So I am currently treating a toddler. So we have toddlers all the way up to older patients, because obviously older people may fall. Children fall as well, toddlers, that's usually the cause. Sometimes it's car accidents that a family is involved in. We see every sport every day. So we have a very large presence of athletes in our program.
Okay. Well, thank you very much for sharing. This has been really helpful in terms of having the resource here in our community, the plan of treatment, the idea that concussions are treatable, but the sooner that you get treated, the better the outcome.
Absolutely. Thank you, Elizabeth.
Thank you very much for your time.
Thank you.
Thank you for joining us. It was such a pleasure to speak with our Lehigh Valley Health Network experts. Next month, we'll bring a fresh lineup of topics to help keep you and your loved ones healthy and safe. Thank you for joining us.